Chris, we have to give our psychology presentation today. I'm so nervous. I don't know what I'm going to do. And I can't breathe.
Robbie, it's okay. Calm down.
Okay. I got this. I do good. Everyone gets anxious sometimes. For some people, the thought of getting up in front of a group of people, it makes them go crazy. It makes their heart race, and it makes them feel sweaty. And for some people, this is an everyday problem. For some people, they have this feeling all the time, no matter what they're doing. It just happens out of nowhere. Today, we're going to learn about anxiety. And we're going to learn about the 5 main disorders of generalized anxiety disorder, phobic disorder, panic disorder, obsessive compulsive disorder, and post-traumatic disorder. We're also going to learn about what these disorders entail, what they go through, and what they can do to improve their symptoms or completely get rid of them.
I gotta go, Lauren.
Oh no, don't go. I feel so alone though.
No, I really have to.
Stay. Chris, stay. Chris, come back, please.
What you just saw was an example of generalized anxiety disorder. In the first example, you saw the person laying in their bed. They kept on checking outside the window because they were worried and anxious about what may be outside. In the second example, the person did not want to be alone, so when their friend had to leave, she asked them if they could stay because she did not want to be alone. In this, we are going to talk about the symptoms of generalized anxiety disorder. Sometimes they include emotional symptoms, behavioral, and physical. Some days are better and some days are worse, and there might be better or worse times of the day as well. Not everyone has the same symptoms. Some examples of emotional symptoms are feeling anxiety, that it's uncontrollable, intrusive thoughts that they try not to think about, but it still persistently comes into their head. And behavioral include inability to relax, enjoy quiet time, and be by themselves. It includes difficulty focusing, whether it's in school or their job. It also includes putting things off and constantly feeling overwhelmed by things that you may have to do. Physical symptoms may be tense muscles, tightness, and body aches, falling asleep or staying asleep, and being edgy, restless, or jumpy. And it could also include having stomach problems. These are all possible symptoms of generalized anxiety disorder.
Chris, do you want to be my dog?
Oh my god, you have a dog! I'm so afraid of dogs! Ah. The preceding was an example of a phobic disorder called cynophobia. Today I'm going to talk about phobic disorders. I'm going to talk about the signs and symptoms of phobias, treatment for phobias, and the prognosis for the future. The signs and symptoms of phobias can range from mild feelings of apprehension and anxiety to a full-blown panic attack. Physical signs may include difficulty breathing, racing or pounding heartbeat, chest pain or tightness, trembling or shaking. You may also feel dizzy or lightheaded, a churning stomach, or have hot or cold flashes and experience sweating. Some emotional signs and symptoms are feeling of overwhelming anxiety or panic, feeling an intense need to escape, feeling unreal or detached from yourself, fear of losing or going crazy, feeling like you're going to die or pass out, or knowing that you're overreacting but feeling powerless to control your fear. The treatment for phobic disorders. There are many treatments, but the most effective way to overcome a phobia is by gradually and repeatedly exposing yourself to what you fear in a safe and controlled way. During this exposure process, you'll learn to ride out anxiety and fear until it inevitably passes. Relaxation techniques such as deep breathing, meditation, and muscle relaxation are powerful antidotes to anxiety, panic, and fear. With regular practice, they can improve your ability to control the physical symptoms of anxiety, which will make facing your phobia less intimidating. Relaxation techniques will also help you cope more effectively with other sources of stress and anxiety in your life. The prognosis of phobic disorders. Many of the specific phobias first appear in childhood and may disappear in adulthood. Only about 20% of phobias that continue into adulthood disappear without treatment, and only 12% to 30% of individuals with phobias seek treatment. Fortunately, phobias are very treatable. Many individuals who seek treatment completely overcome their fears for life.
Oh my god, so school's almost over and
I know.
finals are coming up.
Oh my goodness.
What?
Finals.
Wait,
I
yeah.
totally forgot about finals. Oh my god. I can't breathe. I'm feeling really dizzy. What do I do?
In the clip you just saw, that was an example of panic disorder. Today, I'll be talking about panic disorder's symptoms, treatments, prognosis, and incidence. Panic disorder is a disorder where fear strikes a person randomly and unexpectedly. Some symptoms are shortness of breath, the heart racing, chest pain, trembling, choking, feeling detached from your surroundings, sweating, nausea, feeling dizzy or lightheaded, tingling sensation, and hot and cold flashes. There's a few treatments for panic disorder. There is cognitive behavioral therapy, which focuses on thinking patterns and behaviors that are triggering the panic attacks, and it helps you look at the fears in a more realistic light. And then there's exposure therapy, which it gives physical sensations of a panic attack, but in a controlled environment. There's also medical treatments, like antidepressants, but those have to take for several weeks before they begin to work. For the incidence, it is 3 to 6 million Americans that are affected by panic disorder, and it is twice as common in women than it is in men. And it can appear at any age. By having one panic attack, a person will begin to have fear of having another one. They will fear that when they have one, he can possibly die, or have a heart attack, or go crazy. If there are signs of having panic attacks, it is best to seek early treatment, because this disorder will increasingly get worse and turn into a panic disorder.
In the previous video was an example of obsessive compulsive disorder, or also known as OCD. It's an anxiety disorder characterized by uncontrollable, unwanted thoughts and repetitive behaviors you need to perform. Some symptoms of the obsessive side of the disorder may include fear of germs, causing harm to yourself or others, intrusive sexual thoughts, and a need for order and symmetry. The compulsive side of the disorder may include symptoms of double-checking locks or switches, continuously checking on loved ones to make sure they're okay, counting, tapping, repeating words, or compulsively washing and cleaning things. Treatment for OCD may include going to a properly trained therapist, cognitive behavioral therapy, and going on medicine. Treatment on average, it takes 14 to 17 years for people to get the right treatment. About 7 of 10 people with OCD will benefit from the cognitive behavioral therapy or medicine, and symptoms may be reduced by 60 to 80%. The incidence of OCD is 1 in 100 adults, or 2 to 3 million people living in the U.S. In children, it's 1 in 200, kids or teens, or 500,000. The prognosis of OCD is at onset varies. On average, men will tend to develop OCD more early on in their childhood, whereas women will develop it in their adulthood. Some people have only obsessions and do not behave compulsively. With treatment, symptoms will be reduced by 60 to 80%.
Give me your money. Here you go.
Hey Chris, what's
Oh
up?
my God, get away from me. Stop bugging.
It's just me.
What you just saw was an example of post-traumatic stress disorder, or PTSD. I'm going to talk about the symptoms, the treatment, and prognosis for PTSD. The symptoms may include, but are not limited to, re-experiencing of the trauma. For example, troublesome memories, flashbacks that are usually caused by reminders of the traumatic events, recurring nightmares, and reliving of the trauma. Also, avoidance to the point of having a phobia of people, places, and experiences that aren't mine to suffer of the trauma. You may also have physical signs, including sleep problems, trouble concentrating, anger, blackouts, or difficulty remembering things. There are 4 types of treatment. The first is trauma-focused cognitive behavioral therapy. This is exposing yourself to thoughts, feelings, and situations that remind you of the trauma. The second is family therapy. Family therapy can help your loved ones understand what you're going through. Third is medication. Antidepressants such as Prozac, and Zoloft are the medications that most commonly used for PTSD. They may help you feel less sad, worried, or on edge, but they do not treat the causes of PTSD. The last treatment method is EMDR, or eye movement desensitization and reprocessing. This is rhythmic left and right stimulation such as hand taps or sounds. Eye movements and other bilateral forms of stimulation are thought to work by unfreezing the brain's information processing system. Finally, prognosis. There is medicine that has been found to get rid of the symptoms of hyperarousal, rage, affective symptoms, intrusive thoughts, and outbursts of emotions. But research has shown that PTSD can become a chronic psychiatric disorder that can persist for decades, and sometimes for a lifetime.
The end. Any questions?